Good morning, everybody. Welcome to the SRCD Long-Term Effects of COVID-19 webinar. My name is Dr. Suzanne Lemenestrel, and I'm the Director of Science Affairs for the Society for Research in Child Development. We're thrilled to be hosting this webinar today with the National Academies of Sciences, Engineering, and Medicine. And our mission is to advance the developmental sciences and promote the use of developmental research to improve human lives. Today, we are really pleased to have three SRCD members who served on a National Academies consensus study, which culminated in the report addressing the long-term effects of the COVID-19 pandemic on children and families, which was released earlier this year. First, I'd like to introduce the panelists in the order they're presenting, and then they will each present for about 10 minutes. We'll have 20 minutes at the end of their presentations for questions and a discussion. So if you have questions, please submit them in the Q&A chat box, and we'll have the slides available after the webinar, and the webinar recording will be posted on SRCD's website, www.srcd.org. So first, I'd like to introduce Dr. Stephanie Jones, and Stephanie is the Gerald S. Lesser Professor in Child Development and Education and Director of the Ecological Approaches to Social Emotional Learning Lab at the Harvard Graduate School of Education. Her research focuses on the effects of poverty and exposure to violence on social, emotional, and behavioral development from early childhood through early adolescence. And next, we have Dr. Velma McBride Murry, who holds the Lois Autry Betts Endowed Chair as Associate Provost in the Office of Research and Innovation and University Distinguished Professor in the Departments of Health Policy at Vanderbilt School of Medicine and Human and Organizational Development at Peabody College in Nashville, Tennessee. Her research focuses on examining the significance of context to everyday life experiences of African American families and youth. And then we have Dr. Michelle Sarche, who is a licensed clinical psychologist and associate professor in the Centers for American Indian and Alaska Native Health at the University of Colorado Anschutz Medical Campus and Colorado School of Public Health. Michelle is a citizen of the Lakudere Band of Ojibwe and has partnered with American Indian and Alaska Native tribes in research and evaluation related to maternal and child health and children's development. Welcome to all of our panelists, and we thank you for attending today's webinar. We hope that you find it informative. Please complete the brief evaluation survey, and the link is in the chat, and we hope that you can take a couple of minutes and let us know what kinds of future webinars you'd like to see. And the National Academies team and the panelists are also very interested in how they can further disseminate this report. So next, I will turn things over to Stephanie. Thank you so much.
Thank you, Suzanne. I think Adam is going to share the slides. Okay, so good morning, everyone. Thank you so much for joining us on this really important topic. As Suzanne said, I am Stephanie Jones, and I'll start by saying we have planned a bunch of remarks about the report, and to get through them, we're probably going to go pretty quickly because what we really hope to do is engage with you and hear your questions and talk about what we can do with all of this really important information and how we can create a dialogue that helps all of us move forward. So next slide. I'll just start by giving you some background on the report itself, but I wanted to start by recognizing our sponsors whose generous support made this important work possible. So thank you to the Administration for Children and Families, a division of the U.S. Department of Health and Human Services, and the Robert Wood Johnson Foundation. I also wanted to recognize our amazing study director, Jen Goodman, and Adam Jones, who's on the call with us today, who was a critical member of our team and doing lots of the background research with us. Next. As I noted, we are just 3 members of a 12-member committee that was diverse in many ways in terms of discipline, expertise, perspectives, with scholars from economics, developmental psychology, education, and early learning, equity, and health and medicine. Next. We began our work in the fall of 2021, and over the course of the next 16 months, we met to review and examine the evidence on these three very broad questions. First, what policies and programs are needed to address the developmental, emotional, behavioral, and physical needs of children in high-risk communities to promote child health and well-being in the long term? Next, what was learned during the pandemic about promising practices to support parent and caregiver well-being? And third, what policies and practices can work to address disparities and inequities experienced by communities of color following a pandemic? Next, as we are all well aware, as of January 2023, the COVID-19 pandemic has been the cause, or had been the cause, of over 6.5 million deaths worldwide, over 1 million of them in the US alone. Over 15 million children have tested positive for COVID-19, thousands have been hospitalized, and more than 2,100 children have died. The magnitude and mortality of this pandemic exceeds even that of large-scale natural disasters and portends the risk of negative consequences across health and wellness outcomes for children and their families for decades to come. Next. In the United States, Black, Latino, and Native American people have experienced a disproportionate burden of cases, hospitalizations, and deaths in comparison with their white counterparts. Black, Latino, and Native American people have been about twice as likely to die from COVID-19 as white people, and Latino and Native American people have been about 1.5 times more likely to contract COVID-19 than white people. Next. In our statement of task, our committee was asked to focus on children and families in high-risk communities. Informed by conversations with the sponsors and data on the disproportionate impact of the COVID-19 pandemic on certain populations, our committee defined high-risk communities as encompassing children and families who are Black, Latino, and Native American, and those with low incomes. The report primarily defined children as birth to 18, with an added focus on young adults ages 18 to 24 in certain situations, for example, when discussing matriculation to post-secondary education. Next. So to carry out its work, our committee engaged in a wide range of information gathering activities, including an extensive critical review of the existing research literature in a wide range of disciplines, including the social and behavioral sciences, health and medicine, education, economics. And we held a series of listening sessions with key groups of stakeholders, including adolescents, early care and education professionals, K-12 educators and administrators, juvenile justice and child welfare professionals, and child development leaders from tribal communities. We were guided by several key frameworks, including the life course perspective, which I will come back to, the framework of danger, safety, and protection, which recognizes that individuals experience not only specific mental health conditions such as anxiety or depression, but also a wide range of psychological, behavioral, developmental, and societal responses to danger. And we drew upon the vast disaster literature, which highlights the signature of the event, its type and magnitude, and the dose of exposure, which focuses on how that event affected an individual or family. Next. The committee created this visual of the life course perspective in 20-year age cohorts, which are those bars, oriented around January 2020 and anchored in birth years beginning in the year 2000. The figure focuses at the individual level, where time is represented by ages, life stages, and ecologically salient developmental tasks, such as the start of elementary school or high school. Just by way of very simple example, you can imagine that the behavioral and educational effects of school disruptions for a child just beginning formal schooling are quite different from the effects for a child beginning the 4th grade, who already has things like school routines, early reading, and other skills under their belt. Next slide. We also situated our work in the broader societal context, acknowledging that disasters or large-scale public health events like this pandemic highlight and exacerbate pre-existing vulnerabilities resulting from long-standing societal inequities, including those characteristic of our society, such as systemic racism, along with a host of others. They're listed here on this slide. Next slide. So as such, the pandemic, in our view, has been the great revealer of pre-existing vulnerabilities of long-standing societal inequities. That is, the societal shock of COVID-19, of the pandemic, did not occur in a vacuum or a neutral environment. It landed in an existing inequitable socio-political environment. And that shapes those outcomes that we're going to talk about next. Next slide. So to begin, in terms of sort of like immediate effects, short-term pandemic experiences for children and families, we really have four big categories of things: the experience of imminent danger, the experience of unknown uncertainty around the threat of severe illness and death, a whole host of measures oriented towards social control to prevent disease spread. And then, of course, everything that we all know, the disruptions in everyday life, including home, school, work, businesses, places of worship, and access to healthcare and service delivery. Next slide. So just to put some of those experiences in real life terms, here's a quote from one of our listening participants, a teen. Here's what they say. My mom lost her business. We were trying to maintain everything, but the bills kept piling up. Food prices, rent, everything went up. We didn't know if we were going to get food the next day. It got to the point where I wasn't able to sleep properly anymore or eat properly anymore, and I did gain a lot of anxiety and depression. Next slide. So turning to some of those immediate effects of the pandemic that are well documented in the report, I'll focus now on social, emotional, and educational impacts, and I'll turn it to Velma for mental and physical health impacts. Next slide. So some immediate documented effects of the pandemic on social and emotional development of children include increases in dysregulated internalizing and externalizing behaviors, decreases in children's adaptive behaviors and their self-regulation skills, increases in parents' experiences of stress, household chaos, challenges in parents' mental health, and parent-child conflict. And finally, increases among adolescents and young adults in their level of concern about their present and their future, more time spent feeling unhappy or depressed, and a growing lack of social connection. So I'll just share two more quotes with you. Next slide. The first from an early childhood teacher. Social and emotional impacts have come out in their play, especially in kids from families that were already in tight situations and who then were quarantined together. In addition to using language that their parents might use, they would also often emulate the more teenage language and behaviors of their favorite shows. So we would need to redirect that kind of play and provide context for them to help understand media they encountered at home when their parents were dealing with the stressors of the pandemic and weren't always able to explain what they watched. Next slide. This is from a listening session with teachers. More and more, the focus has been on teaching students how to be in school again. Simple things like raising hands when asking questions rather than shouting out answers or letting fellow students talk without interrupting them, all things that students have struggled with since returning to in-person instruction. Homeroom class became more about providing social and emotional learning and development with students because they needed a space where they could receive the mental health support. One strategy that we found effective was creating small cohorts of students in our homeroom classes where they could practice interacting with each other again. Next slide. Turning to educational impacts, which continue to play out as you've seen in the news, even just this week with the example from the recent NAEP findings for math. As of January 2023, when we finished our work across all measures of school engagement and learning outcomes, we found what we found is that students appear to be worse off than they would have been absent the pandemic. And such negative outcomes are generally more acute for low-income and racially and ethnically minoritized communities. So, for example, we saw declines in early childhood program enrollments, and it was highest here for programs that served more minoritized and low-income families. We also saw declines in K-12 enrollment, such that, well, there were declines across all levels. The largest declines were in kindergarten enrollment. There, we've seen a decrease in engagement of children and adolescents. One measure of this is lower engagement is the high rate of chronic absenteeism in schools, well out of proportion to what we would expect due to illness alone. We've also observed high levels of missed learning, which were highest again among children with longer time periods without in-person schooling. Makes sense. An example of this is that the proportion of kindergartners scoring well below the benchmark in early literacy increased during the pandemic. So that represents a missed opportunity to learn different things. And the greatest increase was for Black and Latino children. And finally, we saw declines in college enrollment, the greatest decline for community colleges, 20% lower in 2021 compared with 2019, and with public four-year college down by 10%, and worse percentages for Native American students. Just one last quote from one of our listening sessions in the next slide. Students were exposed to difficult situations at home, from adult stress about finances or illnesses in the family to older siblings struggling to navigate learning alongside them. They often carried that stress back to school, requiring teachers to create space for difficult conversations in addition to their lesson plans. In addition, technology and social media exposed kids to new behaviors and new ideas that they carried to school and often lacked context and needed explaining. So now I will turn it to Velma for mental and physical health outcomes. Thank you.
Thank you, Stephanie, and delighted to be sharing the stage with my great colleagues, Michelle and Stephanie. So I'll talk a bit about what we found, starting with physical health and then move to mental health. Next slide. So what we know from the report, and as Stephanie mentioned earlier, the report ended January 2023, but there has still been low rates of infections among children and low deaths as well, such that 5% of the children's COVID deaths were attributed to children. But what we saw was an increase in hospitalizations of children. And it was interestingly dispersed by age, that 3/4 of the COVID hospitalizations were for kids younger than 4 and then older than 12. So there was something protective about that middle school age period. But what we also noted in the report was that there was an increase in infections specifically associated with multiple system inflammatory syndrome. And this is a pathophysiological condition that occurred during the time of the COVID infection period in the US, and we're not yet sure what the long-term implications of this particular infection is going to be for children. We do know, however, that when they were hospitalized, there was variability in the amount of time that they were there, such that 4.5% had symptoms longer than 4 weeks, 3% symptoms longer than 12 weeks, and then the symptoms for children that were unvaccinated were 3 times higher than the symptoms of children that were vaccinated. Next. The vaccinating patterns were interesting to observe, specifically, such that we saw the vaccine reminding us that it really was 2 years after the vaccine was available that children were able to receive the vaccine. And so by January of 2023, it was great to see that 40% of the children had received at least 1 dose. Patterns of vaccinations, however, differed by race and ethnicity, with the highest rates occurring among Asian children, followed by Latino children and white children, and then Black children. It is of note that the Native American children were exposed to high rates of vaccination because the uptake of the vaccine was much higher in the Native American communities than in other communities when the vaccines became available. There was oftentimes the low rate of vaccination was due to vaccine hesitancy, and patterns that occurred mostly were low among children, with the exception again of Asian American, such that they were at a higher rate of being vaccinated. There were some strong predictors of who was more likely to not receive the vaccine: kids in poverty, individuals with particular leaning in their counties where the children reside, and then having parents who were unvaccinated or parents who had vaccination hesitancy. Next slide. The racial variability and health consequences, as Stephanie mentioned earlier, this was a great revealer. And that's what you're going to see throughout the entire presentation about the social injustice that was already in existence when COVID landed in our country. And you can see from this slide, again, disproportionate number of children impacted overall by COVID-19 were Black, Latino, Native American children, with all of the consequences: infections, hospitalizations, and deaths. And even when the vaccine treatment was available and approved for children, those in racially and ethnic minoritized group were less likely to have access to the vaccine, thus explains the increased rates of infection, hospitalization, and deaths. Next. We also looked at how COVID-19 was impacting maternal-child health, and it further increased the rate of mortality by 33% among Black, Latina women compared to white women. And so this maternal child health indices, where various groups were disproportionately impacted by that, again was shown that it only escalated during COVID. Lower rates of COVID, however, infections were observed among mothers who were infected. So a positive benefit of this is that it wasn't transmitted to the mother to the child from the mother. Because we're not sure, it's still in the early stages of the game, we're not sure what the long-term effect of COVID is going to be for kids that were in utero at the time. But this fetal origin hypothesis makes us note that it is important to look at their development over time, because it was during key developmental periods when they were part of this COVID-19 situation. And so it's important for us to begin to look at ways in which their life may be shifting over time. While we may not see patterns now, they may have long-term consequences down the road. Next. So as I mentioned, little is known about the prevalence of long-term effect of COVID on children. What we did note, as I mentioned earlier, the number that were infected, and for those that were infected, what we saw, and we're not quite sure, but there was an elevated in type 2 diabetes and a cluster of hepatitis among children who had been infected, but it's unclear if the increase in infection or the onset was due to COVID. Again, an area of research that warrant further understanding. So there's a need to begin to, as we go back to Stephanie's reflection of the life course theory, we really do need to begin to look at this similar to the children of the Great Depression. These are cohorts of children who have been exposed to COVID, either in utero or during early childhood. And we need to begin to ask questions about COVID as we begin to continue our research in the area of child development. Next slide. Other consequences of COVID, because of where kids were, and you saw from the quote earlier, food insecurity and the safety net that they had from being in school disappeared when schools closed. The same thing around decreased access to healthcare, as the urgent attention to healthcare really centered around taking care of patients who had been infected with the disease. And we also saw that there was limited support for children with developmental disabilities, because the services that they oftentimes were exposed to happened in school or in other preventive intervention educational services Again, those were shut down, leaving parents to the mercy of taking care of their own children with special needs. Next. And so I'll now turn to mental health. And next slide. And one of the consequences of being sheltered at home is the fact that children were exposed to parents or situations that increase vulnerability, particularly given the escalated rate of parental stress and conflict happening in many of the families during this time. And so there was an increased risk of harm, especially in those high-stressed households. The National Child Abuse Hotline reported an increase of 20% more calls the first months of the pandemic and escalated over time. Next slide. And this quote from one of our teachers will prepare for the next set of information I'm going to share. The teacher said, this was a teacher in a school in Atlanta, says, children would come back and say they hadn't seen their grandparents in a while, but when you talk to their families, you'd learn that their grandparents may have passed away. They didn't know the depths of anything going on, but you could see the social emotional responses of them being withdrawn or being upset. So we could tell that they could feel the effects of things, but not necessarily explain them. It became our jobs as teachers to say, for example, you seem like you've been kicking toys around a lot today. How are you feeling inside? A major focus of our time became giving them an outlet to be able to express things they don't know how to express yet. Next slide. The bereavement of children was massive. 1 in 168 Native American children experienced deaths, with the highest rates occurring among Latino and white children, between Black children, 1 in 310, and then the rates began to be lower as you look at Latino and white children. Next. What the pandemic did was raise the sense of awareness among children, regardless of how young they were, that something was happening. There was an increased awareness that people were getting sick, that people were dying, fear and threat of it happening to their own families, realizing that there's something shifting in their lives because of physical and social distances from those that they love, from friends and from school. And then they would navigate these symptoms looking then at worrying, depression, and so forth. The next quote, the next slide, will further illustrate how they were really feeling. So the initial response from kids with being able to come back to school was of just being happy to be out and among their friends again, is what one teacher said. The sadness came out when they talked about not having a chance to see their family members in a while. They knew exactly how long it had been, whether it was days or months. So the teachers also observed the shift in their mental health functioning. Next slide. The pandemic created barriers to health and well-being. It had a major direct effect on children in all domains of their lives, including exposure to violence. And it's something that we need to pay attention to in terms of documenting, but also looking at the public health significance of this as children grow and develop. Next slide. The recommendations for Pathway Forward that Michelle will talk much more in depth later, but it's looking at those immediate effects, focusing a lot on being attuned to major shifts in life course trajectories as a consequence of this, and then collectively being thoughtful about how we collect data from children as well as their families, and then ways in which we can be prepared for the next pandemic. Next. When we had listening sessions with youth, it was amazing that they also had recommendations, which we did not ask of them, but they pointed to things that could be done to help them. One of the teens says, after school programs and job opportunities can help establish routines again. It can support us both physically and mentally. And these are things that we need for opportunities that we can have access to, but note that many of these resources are limited in many communities. Next slide. This teen said, She was talking about experiencing isolation, and she noted there was a lack of emotional support that I previously had access to at school through relationships with counselors and engaging in extracurricular activities. She expressed that there was a need for additional mental health resources and more robust social and emotional safety nets at school, another team. The last team recommends that to make things better for me and my family and other young people affected by the pandemic, the government should promote mental health services. A lot of teens are suffering and struggling mentally, and a lot of people don't know it. It's something that needs to be done, addressed, not later, but now. And I will now turn it over to Michelle, who will talk more about the recommendations that emerged through the committee report.
Thank you so much, Velma. And hello, everyone. As Velma shared, the committee's recommendations were designed to create a pathway to recovery and to rectify those underlying inequities that contributed to the pandemic's disproportionate impact on children and families. So the first set of recommendations aims to ensure that the needs of children and families are prioritized in our ongoing pandemic response. And to accomplish this, the committee recommends that federal, state, tribal, and local governments, as well as nonprofits and the private sector, create a task force for addressing the ongoing effects of the pandemic on children and families. Next slide. And that in pandemic management and preparedness planning, government agencies and departments at all levels, federal, state, tribal, pay particular attention to the needs of pregnant people, children, racially and ethnically minoritized populations, children in foster care and juvenile justice, and families experiencing low income. And again, those two things are really, they're cross-cutting and intended to keep children and families, especially those that have been disproportionately impacted by the pandemic, at the forefront as we continue to move through and beyond the pandemic. Next slide, please. To address children's social, emotional, and educational needs, the committee recommends that the U.S. Department of Education renew pandemic-related funding that allocates a greater proportion of funding to high poverty schools in order to address some of the things that Stephanie was talking about: enrollment and re-engagement, academic recovery and achievement, social and emotional development, support for the education workforce, and planning for the next pandemic. Next slide, please. Because Medicaid will be important for ensuring coverage to address the increased physical and mental health burdens children and families faced, as Velma was talking about, the committee recommends that HHS establish and enforce standards of care for Medicaid and the Children's Health Insurance Program. And that should include national standards for equitable payment rates, presumptive eligibility, continuous eligibility periods, and network adequacy. Next slide, please. And that HHS, or the Department of Health and Human Services, increase investments in behavioral health care in particular, so connecting to that last quote that Velma shared, by advancing policies that ensure mental health parity, expanding Medicaid payments to include preventive and community-based services for mental health, and strengthening the behavioral health workforce through increased training, opportunities for racially and ethnically minoritized individuals themselves to enter the child behavioral health workforce, and loan repayment programs, again, for that behavioral health workforce, especially those focused on children and families. Next slide, please. The committee acknowledges the important role that federal level interventions will play in addressing families' economic needs, especially given widespread state level variation in the type, amount, and duration of many safety net programs. The committee recommends that the federal government incentivize states to expand the number of families served, raise floor benefit levels, and reduce administrative burdens in programs such as TANF, or temporary aid for needy families, and childcare subsidies. Next slide. Given the evidence for the positive effects of paid leave on work attachment, family bonding, and maternal and child health, the committee also recommends that the federal government support federal paid family and sick leave programs, or that it incentivize states to implement their own paid family leave programs. Next slide. Also, to address families' economic needs, the committee recommends that the federal government continue the pandemic era expansion of the child tax credit, including its distribution on a monthly rather than yearly basis. Or again, in the absence of such federal expansion, that state governments should implement their own monthly child tax credit payments. Next slide, please. The committee's last set of recommendations, and the ones that we're hoping you might, as our SRCD audience, be particularly interested in, are those relating to future research and data needs. While evidence about the short-term effects of the pandemic on children and families is beginning to emerge, as we've shared here, the long-term effects remain unknown. The committee therefore recommends that public and private agencies at the federal, state, and local levels eliminate barriers to and support mechanisms for child and family serving systems to collaborate on the systematic linking of data with other federal and state administrative data. Next slide. And that the federal government prioritize and fund research on the effects of the pandemic on children and families, and ensure that COVID-19 exposure and adversity questions are incorporated into existing national studies, such as the Youth Risk Behavior Survey and the Head Start Family and Child Experiences Survey. Next slide, please. The committee believes that without focused strategies such as those outlined in the recommendations I've just shared, a generation of young people will enter adulthood with worse mental health and greater disease burden, and this will be more pronounced, as we've seen, among youth from minoritized and low-income communities. Next slide, please. And with that, I wanted to share this quote. We're going to transition now into discussion with all of you. And to prepare us for that discussion, I wanted to share this quote. This is from the novel, The Sentence by Louise Erdrich. The sentence is set in Minneapolis in the summer of 2020. And this quote is shared at the very end by the main character, Tookie, who observes that she says, "I want to forget this year, but I'm also afraid I won't remember this year. I want this now to be the now where we save our place, your place on earth." And here she's talking to her beloved grandson. And we share this quote because we're at a phase in the pandemic that I think we are really being pushed to move on and to move. Yet, as much as we want to move on and move forward, everything that we've experienced over the last 3 years is not going to simply be forgotten in the lives of children and families. These are experiences that will stick with children and families for many years to come. And so I think we still have an opportunity before we forget, as we might want to do, everything that has happened because it's been so difficult. But I think it's incumbent upon all of us to really keep these conversations alive about this very significant event, this pandemic, and how we as researchers, as practitioners, can keep this present in the work that we do and ensure that the long-term impacts are mitigated. So we invite your questions now to reflect on everything that we've just shared, and also to think about what we might do as researchers moving forward. So we have a couple of questions just to put out there for all of you. And one is, how can we keep this work that we've just shared here? How can we keep it present and share it to multiple audiences, even at a time when people may be tired of hearing about the pandemic? And how can we build a coordinated research effort that allows us to continue to learn from and document the experiences of children and families during and now moving beyond the pandemic? And so with that, we're going to just open it up for discussion and reflection. I haven't been following all the chat.
Yeah, there's
presenting, but I've seen a lot happening.
Yeah, thank you all very much for the presentation and the overview of the report. And for people in our audience, I included a link to the full report, which you could download from the National Academies of Sciences website. So do you all want to start with Michelle's question about how to keep this all alive? And then we can turn to some of the questions that are in the chat.
And I'm assuming they will respond via chat, Ms. Suzanne? Or
Well, we can,
they can unmute.
just some of these. Yeah, yeah, people can't speak, but we could address some of these first. So there is a question.
No, I didn't. I'm sorry, I didn't mean that. In terms of the audience to respond to our question, will they do that by unmuting themselves or through the chat?
They would have to do that in the chat. Yeah.
Okay.
They
Thank you.
won't be able to speak. Yeah.
I see some people are starting to put some things in, which is great. We encourage as much of the dialogue as this format allows us. We'd love to.
So, you know, I think one question that I have for all of you, because we have a lot of developmental scientists and students watching today, what role do you think that developmental scientists should play in ensuring that the experiences of children, youth, and families who are the most negatively impacted during the pandemic are not forgotten? So this could be like, you know, through some kind of research agenda. Or what would you say the role of developmentalists is?
I'll start. A really important role. So I mean, I think that developmentalists have, as we all know, a quite specific view on how to understand the effects of a set of experiences like this in the long term, and, you know, rooted in that life course model, taking into account a history of experiences, the developmental moment when the event occurs, and then the likely outcomes that result. So I think what developmentalists are bringing to the table, among many things, is this framing that requires that we think about what happens for specific children, for adults, in a manner that rests upon these other factors. So what's already happened? What is the sort of developmentally salient, ecologically relevant task at hand? And then what are the right kinds of outcomes to make sure we focus on? So that's one big thing, and we can keep those ideas front and center. I'll turn it to my colleagues.
Yeah. When I was thinking about, great response, Stephanie, I was thinking about, you know, one of the things that the life course theory helps us think about is on time, off time, and early developmental progression across domains. And it's important to be thoughtful about that, because when we think about where kids are, I mean, a critical explanation of this happened during one of our listening sessions with an 11th grade instructor who teaches 11th graders. She said, let me start my conversation with you by saying, when these kids, when the pandemic occurred, they had finished the 8th grade and were getting ready to begin the 9th grade. They started school in the 11th grade. And so they missed this developmental period where they may be intellectually ready, but socially, emotionally, they're like eighth graders. And so it's to be thoughtful about that in the way that we look at our own research and to critically embed life course in developmental human development theories. So we may want to do, well, there are lots of comments happening.
Yeah, there's a lot. Michelle, did you have any follow-up on that question?
Nothing to add, so we
Okay.
can.
So there's, I'm going to combine these together, but there's two questions. One, what did you find or what did you learn about the mental health of infants and young children, not aggregated with youth? And then the follow-up to that was, what are your recommendations for building emotional strength and resilience? And I'm assuming this person is interested in especially young children.
Yeah.
So I'll start with the young children. The way in which what we know is being able to really document exactly how the pandemic was impacting infants and children occurred through the observation of adults. And so it's what the adults were able to see in terms of changed behavior, because we didn't have them in an experiment. There were no experiments happening where you could see shifts in their brain reactivity or being able to document minute by minute shifts the way we would do in a lab, for example. None of those studies are available in our country at the time because of what was happening. So we only know, and so the quotes from the teachers, the early childhood teachers, and from the parents is really our way of understanding what was going on with them, with these infants and children. Stephanie.
Yeah, agreed. And there are a handful of studies that were ongoing and interrupted by the pandemic, but able to regroup very quickly and continue to gather data largely from parents about how young children were doing. So less about infants, more about the 4, 5, 6, 7-year-old set. So, and those studies, including the EC RAPID study, which did sort of rapid sampling of a nationally representative group, asking parents and early educators in particular about the children in their care. That kind of study, and then this handful that had like pre-pandemic and then some parent report post-pandemic largely document declines in children's social and emotional functioning, in particular, the domains of functioning that sit inside the regulatory area. So challenges in self-regulation, increases in dysregulated behavior, which you can imagine, because there were co-occurring documentation of increased family stress and strain and parent-child conflict, also in relation to young children. So as we know from decades of research in developmental psychology, that those two areas tend to travel together. So there is some information. I'll say that those studies have continued to report effects even after our report was finished. And so there's more coming out about that. Oh, strategies. Well, in the report, there's a variety of things listed, including mental health consultation, robust, expanded, high quality social and emotional supports inside early childhood settings, and linked to families through home visiting. So those are at least 3.
I was also remembering in terms of infants and young children, in one of our listening sessions, and someone shared how, and I think this is just an example of the losses during the pandemic were not just loss of life, but they were missed life experiences and opportunities. And so I remember one of our listening session participants sharing just how significant it was. And this person was a Head Start director for families who were giving birth during the pandemic and had to do that in isolation. there weren't any visitors at the hospital. There wasn't help for them when they came home, perhaps, and just how those missed opportunities that will never have the chance to go back and do those things over again. Could be graduations, birth of babies, and any number of things. So when we think about measuring the long-term impacts of the pandemic on children and families, I think it's important to be mindful of those types of losses that have occurred and how that affects children and families moving forward.
So I'm going to thank you all for responding to that question. We have a bunch of questions coming in. So there's a question about how the panel defined and operationalized high risk. And Michelle and Velma, do you want to address that?
Sure, and I can start.
Sure.
But Steph at the beginning mentioned that it was a collaboration between the funders and their charge to the panel. And it really emerged from knowing that COVID had disproportionately impacted these groups of people because of the deaths, the infections, the inaccessibility to treatment and access to the vaccine. And they wanted to know, how are their lives being impacted as a consequence of COVID? So it was really a collaboration with the funders informing us what they would like for us to focus on and why, because this particular population was experiencing the brunt or the burden of COVID and want to know more about what's happening to them and their children. Later during the pandemic, we saw an uptick in the kind of stressors experienced by Asian American families as a consequence of the labeling of the origin of this particular pandemic, connecting it back to China, which then you began to see increases in the inclusion of Asian Americans as being impacted by this. But the deaths initially and the infections initially were really about these three groups of people. And so that's where that really occurred from our funders.
So yeah, just to underscore, high risk was really with respect to that morbidity and mortality of the disease. And again, that's not to say that there were not other very negative impacts for many other groups than what the report focused on based on its statement of task, if you will, by the funders.
So thank you both. And I'm gonna, there are a couple of questions about groups that maybe, and I don't know if you who would like to address this, but there are a couple of groups that maybe didn't seem to have as much attention in the presentation or the report as other groups. And so this includes AAPI children and families, and also children with disabilities. This could be they could be covered in the report, but if someone would like to address those questions.
I'm happy to talk. I think we talked about the Asian American and Pacific Islanders in answering the question about high risk in terms of why they were not initially focused on. It's because of mortality and infections, who was being impacted at the time, which was a trigger for the funders to want to know more about this. The other groups became a focus as a consequence of the labeling of the pandemic. And again, one of the things that we constantly said as we were engaged in this committee activities is that it was an ever-evolving story. And that even when the report was released, it was still new information coming along. But at some point we had to end because the funder said we had to end. And so we really wrote it as a working document such that it should be further expanded to include the things that were missing at the time. What we know about children and disability, I touched on it just a bit in the presentation, but they lost the services. And so they did not fare well because services closed down. And when those services closed down, the families were responsible for taking care of them. But the extent of it, while we talk about this as long-term effects, we don't know what the long-term effects are. We see glimmers of what the landscape may look like in the future. And we're encouraging our colleagues and practitioners to be thoughtful about that as we move forward, looking at these cohort of children and families impacted by this pandemic. I'll stop. Stephanie and Michelle want to add more.
No, I think you covered it, Velma. I'm noticing in somewhere, it's either the chat or the Q&A. Can't really tell the difference between them anymore. But I think there have been a few questions across them about like what kinds of things can we do in research or like what things are happening to catalog effects, to consolidate measurement tools, to track the impact of interventions that may have started during this period. And because that was one of the questions that we raised, and because this is the SRCD community, it seems really important for all of us to think about ways to coordinate on existing studies that began before the pandemic and are continuing. There are a handful of those, and ensure that we either harmonize on measures and bring them together to build a more robust understanding of the long-term impacts of the pandemic on children and families. I'm not sure, to Larry's question, that there is a sort of building catalog of intervention studies that began during the pandemic and are ongoing, but I think that would be incredibly helpful, because one of the questions, as we noted, that we really can't answer is the impact of interventions in the context of the pandemic, because we were in it and we didn't have lots of studies already that were giving us that information. So beginning to build a catalog of the stuff that's started during the pandemic and is ongoing would be really helpful. So I think that there are a number of ways that this community can come together to contribute to our ongoing understanding and then responses to what's happening by collaborating on existing work, new work, and at least documenting who's doing what. So I'll turn it to Velma and Michelle on that question, because this is something we have talked about a lot. It would be great if SRCD were willing to like push an effort like that. I'm sure there are lots of people on this call. I know three, I'm looking at three right now, who would be willing to work on something like that.
Oh yeah, and if there's a way, I really like the idea of SRCD serving as a convener, which could be identifying from members who has data, who's willing to set up these teams to begin to uncover some of these critical issues. And the other thing that I thought about was a way to begin to also catalog what people did in the moment, in the community, the grassroots organizations that came together, churches, for example, and other faith-based and community organizations. People were urgently engaged in innovative work to begin to address what was happening to families in their community. So, but I think a lot has happened. We just don't know what has happened because we don't have someone organizing it and bringing it all together.
And to that point, I know we need to wrap up. Velma, you're really touching on one of the comments in the Q&A was, what about children who did well during the pandemic? And I think it's important to remember that there were really incredible, insights and awarenesses, and that we all had about how we want to live our lives and what our priorities are, and the shifts that we've made, some of which are innovations and adaptations for the better, and that we will want to continue to hold on to live our lives in a different way. We're not just going right back, hopefully, to where we started the pandemic. We've been changed very profoundly in negative and hopefully positive ways as well. And so I think in that research and measurement, it's really being mindful of what did we learn? What are the positive adaptations and innovations, again, that are promising for moving forward?
Yeah,
Great ending, Michelle.
we have like 1 minute. So just to wrap up, thank you all. We're sorry that we couldn't get to all of the questions. We did post the link to the full report that's available on the National Academies Press website. We will have a link for the recording and the slides available on SRCD's website. And I have in my notes that I need to find funding to help us build a database repository of measures and studies to host on our SRCD website, which I'm sure a funder out there might support. But thank you all of you who are listening and participating. Thank you all for your excellent questions, and we really appreciate it. Thank you, Velma, Michelle, Stephanie, for your time in preparing the presentation, and for the excellent responses to all of the Q&A. And I hope you all have a great rest of your day. Thank you.
Thank you all for joining. Thank you, Suzanne, for hosting, and
Yes.
SRCD.